This is Brent of the Brook Bush Institute, and in this video we're going to go over manipulations or high velocity thrust techniques. I assume that if you're watching this video, you're watching it for educational purposes and that you are a licensed professional with high velocity thrust or manipulation techniques in your scope of practice. If you're not sure, check with your state board. Most physical therapists, chiropractors, and osteopaths, you're in the clear. I believe that ATCs, you can't do manipulations in the United States, although other countries. Again, check your scope. Of course, massage therapists and personal trainers, these are generally not within your scope. Of course, you could continue to watch these videos just for educational purposes, learn a little anatomy, learn a little biomechanics. If you're going to do these techniques, please make sure that you have a good rationale for putting your hands on a patient. This should be based on assessment, and if you're going to assess, I'm hoping that you'll assess, use these interventions, and reassess to ensure that you're getting the result that you're looking for and have good reason to continue using this technique. In this video, we're going to go over thoracic manipulations. These are the thoracic manipulations that are a P to A, high velocity thrust, also sometimes referred to as the screw manipulation. I'm going to have my friend Yvette come out. She's going to help me demonstrate. Now remember, if we're doing manipulations, guys, we're doing manipulations because we need to increase mobility in a segment that we think is stiff, and that's going to be based on not just subjective information, but objective information as well. For example, maybe we've seen some signs of upper body dysfunction during like a postural exam, maybe arms fall forward or shoulders elevate during one of our movement patterns. And then maybe since we don't have great goniometrics assessments for our thoracic spine, we could use something like a rotation test for thoracic mobility that we could at least use as an assessment and reassessment as we're going through our interventions. Now, the screw technique is probably the one that everybody is most familiar with and tends to be the most detailed as far as its explanation. And that's the one where we find transverse processes, right? And we go the transverse process above and below on opposite sides. And then this is called the screw manipulation because we press down on both sides, which is supposed to do this with our thoracic spine, which causes the manipulation. That's great, and I think it's a good technique to start with to get some detail in, but I've also seen people just come and press. I've seen people come and press this way. I think all of these techniques generally work, and the reason being is it's very hard to be specific to a particular joint in the thoracic spine, especially when you consider not only the number of facets, but the number of costovertebral facets. So you have 2 costovertebral joints on every transverse process, plus your facet joints. I think when people do these manipulations, a lot of times we're getting multiple cavitations because we're manipulating a lot of joints in a segmented area, right? So with that being said, let's start with the detailed screw PA thrust. All right, so the first thing I need to do is maybe start with some palpation. In this position, I'd probably do my PAs using my piezoform hamate grip this way. All right, so we'll say I've already done cervical, I've already done my upper thoracic spine as part of my cervical exam, and now I'm kind of in through here. And I'm just gonna feel for some stiffness here. Maybe I ask Yvette, hey Yvette, is any of this painful or just a lot of pressure? Just a lot of pressure, right? Mm-hmm. And you do have to put quite a bit of pressure just to get to the end of arthrokinematic motion in the thoracic spine. There is definitely some movement this way that can happen. And I think what we're finding here is I feel Yvette's a little stiff right here. This is kind of common actually with women. You'll find that right about where the bra strap would end up, they either end up really stiff or hypermobile. It seems like they either end up stiff because of all of the maybe pressure, and maybe that's a compensatory pattern, or they end up hinging over that point. And then of course we wouldn't want to do a manip there. But she is definitely stiff a little bit right here. All right, so I keep doing my PAs. You guys just saw me cheat there with a little bit of like general spring testing. You will see like PAs would be specific. Sometimes you'll see people just kind of do this thing, right? And this is just kind of a spring test to see if they can feel any of resistance. Another thing that you might be able to feel is like tissue density. So maybe some overactivity around the segments. And like we definitely have some stuff going on here. So what I'm going to do is I'm going to find my transverse process. Now if I kind of go out just about an inch from either spinous process, I can feel the transverse process, and then I can actually feel a bump right here about 2 inches from the spinous process. That's where the ribs start, right? There's that little bump there at the beginning of the ribs. But let's say I find these two transverse process, and I'm going to kind of switch my fingers this way a couple times so that I rotate in both directions, figure out which one's stiffest. All right, so she tends to be more stiff this way. All right. So what I'm going to do is get my piezoform hamate on either of those transverse process. I'm going to kind of take up all the tissue slack so that my hands don't move around. And there's a couple ways to do that. You guys can kind of twist your hands. You can kind of move up into position so you take up tissue slack this way. But you definitely want to do something to take up a little tissue slack, because otherwise you'll go and press and your hands will move off those transverse process. And then I'm going to ask Yvette to take a nice deep breath. And when she breathes out at the bottom, I'm just going to do a little quick. And that's it. I think you guys have seen Yvette in some earlier videos. Yvette's not used to getting manipulations, which I actually kind of like for these videos, because I feel like she's very similar to a new patient, which I think you guys need to be aware of, that not everybody loves to get manipped. Some of you guys might like to get manipped. Other people hate to get manipped, but it's what they need, right? Manipulations are very effective for increasing mobility. They're very effective for decreasing pain for a lot of different pathologies. So again, guys, going through that, all I did was find 2 of these transverse process where she was tight, and I just kind of set my body up right over the top, and then just gave a quick PA down. Now, since my hands are set up on we're the kind of catty corner transverse processes here, when I pressed down, it did this to the 2 vertebrae. Now, could I have just laid my hands down like this? Chances are yes. I think people get a little too caught up in the details. If I have somebody who's coming in for general thoracic stiffness, and I'm not dealing with somebody who's has very specific pain. For example, if Yvette had come in with very specific pain right underneath where her bra strap was, I thought there was a chance that there was a hypermobile segment surrounded by stiff segments. That's a good reason for me to be very specific on where I'm going to apply these techniques. But if that's coming in because she's been suffering from thoracic spine tightness, maybe we start hearing about things like she's got desk work followed by these group classes that she teaches, and we think she's probably sitting in really bad posture, and then reinforcing it with workouts because she doesn't really get a chance to do any sort of movement prep before she goes into this group class. I just want to loosen this up. I probably can just put my hands down, right? Take up my tissue slack, big deep breath for me. Breathe all the way out for me. There you go, relax. And there you go. Right, you guys saw I just kind of set my hands down and I got multiple cavitations. Do I know whether it was thoracic facets or costovertebral facets? No. And honestly, it might not matter in a case of general stiffness. In a case of general stiffness, all we want to do is see improvement on our reassessment. And if that was, for example, upper body, for example, maybe she didn't get her arms all the way back during an overhead squat assessment, or she was performing poorly on a thoracic spine assessment, now I would just reassess and see if that got better. And if it did, good, then that was the right technique to use. I've seen people do this thing as well, and sometimes that works really well. That's not a technique I'm particularly comfortable with, but you could just do hand over hand and push down, and now you're kind of doing like a central PA high velocity thrust. I think with all these techniques, you need to practice, the ability to feel where the stiffness is probably is the most important thing, because the techniques themselves aren't hard. The only part that you as a practitioner need to get real comfortable with is setting your body up in a way that you're using your biomechanics and not your arm strength. Because if we were to flip places and a vet was to try to do this on me, granted I probably outweigh a vet by about 100 pounds, I'm almost twice her size, right? She's gonna have to have really good mechanics to be able to move my thoracic spine in a way that's gonna get a good manipulation. And the way to do that, of course, is to get the table low enough to get your arms straight so that you can then use the weight of your torso in a quick fashion. You're almost kind of thinking about, I'm just gonna drop my weight in and try to straighten my arms out at the same time, and kind of like a little bit of a, I don't wanna say like punching motion, but like you're just kind of doing one of, all right, I'm all set up, and then I'm just gonna drop in, right? So I'm gonna kind of straighten my arms and let my body weight all fall at the same time very quickly. You are gonna have to move a little more than you expect, right? If you guys have ever done like the CPR training, think about how far a sternum's willing to move. You know, you gotta push the thoracic spine a good couple of centimeters before you're gonna get any of these cavitations to happen. Last, guys, you could potentially, I wouldn't suggest this for everybody, but you might be able to get some of the upper thoracic spine by doing a technique up here. Notice that if I'm gonna do this, I'm gonna tilt her head down a little bit into flexion. That seems to help. I might go cross hand or this way. I'm kind of pushing in this direction, right? Nice deep breath. And then I would push down hard here. The one problem with that particular technique, guys, where you want to be careful, is you do have to use quite a bit of force, and it does tend to push people's clavicle very hard into a table. And for some people, that's enough to be uncomfortable enough that they don't want to do it again. For individuals like that, I would go back to my mobilization techniques, remembering that most of the research points to manipulations being a little more effective than mobilizations, but mobilizations being generally very effective unto themselves. Guys, stay tuned for the close-up recap. All right, guys, for your close-up recap, I wanted to give you a little different view here. Of course, we would go through and do our palpation. Right? We'll take up all that arthrokinematic range. Ask a vet here, hey, does that cause you any pain? No, so we might get a little extra information on top of palpating stiffness on whether that particular segment seemed to be the one that was causing some of her symptoms, especially if that pain is related to her concordant sign. Now, other things we might be able to tell is, do we have like tissue increases in tissue density, right? Overactivity in any of the muscles around a particular segment. And I kind of mentioned to you guys, sometimes just coming through and just doing like a general spring test, you'll feel where the spine is generally tighter, right? We found with the vet, this seemed to be your tighter area. Now, if we wanted to get real specific with our screw technique, and we had found a couple spinous process that were really, really stiff, remember that your spinous process actually are quite long in the thoracic spine, so that the transverse process that is related to it, a little trick here, guys, if you fall off that spinous process to the side and start rotating, you're probably gonna have to go about 2 spinous process up, but you can kind of lay a thumb down and feel where that transverse process related to that spinous process is, right? So right here would be that particular segment. I could put one hand here. I could then go one below it or one above it, right, with the other hand. And then have a vet take a nice deep breath, breathe all the way out, follow her down. And then of course my chest is right over my hand, so I can just drop in and give a quick thrust. And just like that, we got a nice little cavitation via our screw technique, which is called screw technique because it basically does this with the 2 vertebrae that we're pressing. Now, I did mention that just general hand placement, like as long as you're on either side of the spine, chances are a PA thrust will get you some good manipulations. The problem with that technique is it's not specific. The advantage of that technique is it's not specific. You're probably getting a lot of stiff joints involved, maybe some costovertebral joints, as well as facet joints. Of course, I've even seen this work where the spinous process is put in between the thenar eminence. And essentially that's just a central PA thrust. I don't tend to use that one very often. I think it's a little bit more uncomfortable for the patient and not as effective as the other techniques I just showed you for the thoracic spine. Guys, give these a try. Really start doing some palpation before you try the thoracic manipulation if you haven't been successful. I think just determining where on the spine is stiff will be the biggest jump in your ability to make this technique successful, as opposed to continuing to just work on smashing the thoracic spine, which I think with a little practice anybody can get pretty good at by itself. A couple of points to recap. Knowing your anatomy and knowing your biomechanics will certainly help you choose the right technique for the right patient. If you're unsure whether manipulations are appropriate due to their higher intensity, it's okay to do mobilizations. Most research points to manipulations being slightly more effective, but mobilizations being very effective. And of course, we have those videos for you if you want to start with those less intense techniques. Make sure that if you are doing any technique that is based on assessment, and of course that you're reassessing, ensuring that the technique is effective for the patient that you're working on. And when it comes to all manual techniques, guys, manipulations, maybe more than any other, look for opportunities to get live education. Although I know videos are convenient and I'm happy to have these up for you guys to watch, it would be so much more helpful to use those videos as a recap of one-on-one attention with somebody who's experienced with manipulation techniques. At the very least, grab a colleague, grab a friend, and start practicing these before you bring them into clinic and start using them on patients and clients. I hope you enjoyed this video. If you have any questions, please leave them in the comments box below.